Hello, I'm Dr. Brandt Gibson. Today I want to talk to you about Charcot arthropathy, Charcot Neuroarthropathy, or Charcot Foot, which is a neuropathic condition, or basically it's a bone condition, a destructive joint disorder that happens in individuals with neuropathy. Now, that being said, a majority of individuals that get Charcot Neuroarthropathy are diabetic. So in diabetes, you got 0.1 to 0.9% of individuals with diabetes will have Charcot Neuroarthropathy. Of those that get Charcot Neuroarthropathy, 63% of those patients will get ulcers, foot ulcers on their feet. Now, does that mean that you have to have diabetes and neuropathy to get Charcot Foot? The answer is no. Charcot Foot can happen in any neuropathy patient, although it is very rare, much more rare in individuals that do not have diabetes. So how does neuropathy, the Charcot neuropathy, or Charcot Neuroarthropathy, how does Charcot Neuroarthropathy present? It actually presents in 3 stages. The first stage is called the acute stage, where you start to get a red, hot, swollen foot, and the x-ray starts to show fragmentation where the bones are starting to break down and you're starting to see little pieces of the joints. And you may even get joint dislocation, although it's early on joint dislocation. Stage 2 is subacute, or coalescence, where it starts to, the redness and swelling and warmth starts to decrease, and you start to see bone trying to heal in those new positions. And stage 3 is chronic, where you get consolidation, reconstruction, and the redness, swelling, and warmth are gone. You have bone healing or non-union and residual deformity in the foot. So let me use this model here, and we'll actually kind of show you kind of what happens. So if this were the normal foot, Charcot Neuroarthropathy will typically most commonly affect the middle of the foot. And so what happens is you get dislocation where the foot starts to collapse, and you start to get bones that are sticking out on the bottom of the foot instead of where the way they're supposed to be. So you get those pushed down, whatever, you get the flattening of that foot, you get to the point where you actually get almost like a rocker bottom type foot, and you get significant deformity. So how do you prevent that? The truth is, if you have neuropathy and you start getting a red, hot, swollen foot, the first thing you should be thinking of is possible Charcot Foot, and it should be evaluated for that. Although it's not common, you want to have a suspicion that it could be going that direction, because the earlier you treat it, the less deformity you have, the less problems you have. So really what it comes down to is, why does it happen? What is the reason? What is really happening? Why do we think that it's actually happening? There are 2 possible accepted theories of why this is happening. One is neurotraumatic, and the other is neurovascular. So neurotraumatic theory proposes that you have the neuropathy and you get repeated trauma in the joint, and it just over time, just like a stress fracture would happen in the foot, you get this repetitive trauma that ultimately causes joint destruction. The neurovascular theory suggests that you get an increase in peripheral blood flow, resulting in osteolysis or demineralization. So how do either one of these work? The truth is, if you look at it, you're saying, okay, you've got traumatic injury, you've got a neuropathic foot, and you're continuing to get the stress in that area, and you can actually get stress fractures and then break down the tissues and so forth. And the neurovascular, you've got the autonomic neuropathy type changes where you get less control of the blood flow and you get a washing out of the bone. My opinion, and this hasn't been proven yet, is that it's probably a combination of the 2, where you're getting micro traumas and you're getting changes in circulation, and you're getting even possibly an additional loss of the motor functioning in the area, so it's not supporting the foot like it should, and over time you just start to get everything coming together. So it's a combination where the foot starts to break down, you get red, hot, and swollen because you've got a fracture, and because of that you're actually getting more problems, more issues, and so forth. So what do we do to treat it? So what are your options when it comes to treatment of neuropathy, or the neuroarthropathy, or the Charcot Neuroarthropathy? What are your options for treatment? Truthfully, there's a non-surgical and there's a surgical treatment option. Non-surgical is usually splinting, taking the pressure off, walking braces, orthotics, casting. You can get a total contact cast where you actually wrap the foot and it doesn't allow any movement. You want to basically protect it so you don't get any more destruction over a period of time. Surgical is the other option, especially when you get pretty good deformity, because you can actually remodel it and you put screws, plates, so forth in there to create pretty significant support. You're basically using the rebar technique where you're saying, okay, just like we put rebar in cement to cause extra strength, we're putting screws and plates and everything in place to support those bones until you get to the coalescence, the stage 3 coalescence phase where it starts to heal, and it's holding it in the position you want it to heal in. So this is Dr. Brandt Gibson, and this is a common, serious problem, although it's very rare that it happens. If it happens, it's commonly very serious. That can happen in a neuropathic foot. This is Charcot Neuroarthropathy, Charcot Arthropathy or Charcot Foot, and it is very important that you understand it and that you're watching for it. This is Neuropathy Nugget Day